Are you confused about the diet that you're supposed to follow before surgery? In this video, I am going to clarify that pre-op diet for you so you know what you're doing and that you are starting on your road to success as you prepare for your weight loss surgery. Hi there, my name is Diana Lopez. I am your bariatric dietitian / nutrition coach at My Bariatric Adventure. That's the place where we guide you as you navigate the twists and turns of your bariatric adventure. So let's talk today. We're going to talk about that confusing, stressful pre-surgery diet. If you have had friends that maybe have done this before, or if you followed people's journey on social media, it can maybe seem a little daunting, a little confusing, a little bit stressful. So let's demystify that and talk about the different types of pre-op diets there are out there. And I'll give you a little guidance as to what you need to do depending on which diet you're following. And after we go through that, hang around a little bit, I'm going to give you 4 or 5 extra bonus tips to help you make the most of that pre-op diet. And then if you stick around to the very end, I've got a freebie for you as well to help you to be successful on your weight loss surgery journey. All right, so let's dive in. There are possibly about maybe 3 variations on a pre-surgery diet that your surgeon has recommended for you. So let's dive in and talk about those. Before I do that, I want to say that for the pre-surgery diets and the post-surgery diets, the diet stages after surgery until you get back to eating regular solid food again, it's going to vary greatly. So every surgeon has their own way, every practice has their own way of doing the pre and post-op diet. And so if you're following somebody out there on social media, if you've had friends or family and they've had weight loss surgery with a different surgeon, a different practice than what you are, the practice that you're going to, their diet's going to be different. So you want to stick to the guidelines that your surgeon has given you because there are specific reasons they have you following that diet. So let's talk about those diets. So number 1 would be meal replacements. So that might be maybe something like BariLife or OptiFast. Maybe they have you ordering pre-made packaged foods that you can eat, and usually what it might be, meals, it could be soups, it could be protein bars, it could be protein drinks or powders. And so they're probably going to have you doing those, taking one of those probably 5 or 6 times a day. So every 2 or 3 hours you're going to be eating a bar, heating up a meal, or doing something with that. So that is one option that's pretty easy to follow. That's the meal replacements. The liquid protein diet, that really what that is your surgeon has recommended that you drink maybe 3 to 4 protein shakes a day. In my practice, the surgeons that do that, they're looking for you to get between 90 to 120 grams of protein a day. So depending on how much protein is in the shake you're drinking, that may be anywhere from 3 to 6 shakes a day. So the first part of that is the protein part of the diet, and then the second part is the liquid part of the diet. So the liquid is clear liquids, which are, if you pour the liquid in the glass, basically if you held it up to the light, you could kind of see through that. So that would be also things that really don't have calories, less than 5 to 10 calories per serving. And those are going to be things like Crystal Lights, meal drops that you put in your water. It might be any kind of broth, whether you make the broth at home or you buy it pre-made, doesn't matter. You can add seasonings and spices to that as well. It might be sugar-free popsicles, sugar-free Jell-O. It could be herbal teas. Let's see what else is on that. It's pretty simple diet. Water, of course, you can add lemon, lime to the water that you're drinking. So pretty simple diet that your surgeon may prescribe is one that is real food or a combination of real food and protein shakes. So what I have seen is it might be kind of like a slim fast kind of thing where you get 1 meal a day and maybe get 1 or 2 snacks a day. And then the other 2 meals are either shakes or you're just having a couple ounces of protein. So for this diet, it probably would be wise to invest in a food scale so you know how much protein you're taking in. So, after you cook a piece of meat, then you would measure it. So usually like let's say at breakfast and lunch, it might be 2 ounces of a lean or a very lean protein, which would be things like chicken, doesn't matter if it's white or dark meat, some sort of white fish, it could be tuna packed in water, it could be beef or pork tenderloins, it could be shellfish like shrimp, it could be clams, it could be oysters. So as long as those things are not packed in oil, those would be good options for you. Usually your surgeon will give you a list of things that you can have if they have you following that diet, or they may give you a pre-made meal plan where they've planned out every single meal and told you what to eat for that period of time that you're on that diet. So usually, like I said, breakfast is protein, a couple ounces of protein or a protein shake. Lunch is a couple ounces of protein or a protein shake. And then dinner, maybe a meal. And usually the meal maybe is going to be about 3 ounces of protein. And then they'll allow you to have 1 to 3 servings of non-starchy veggies, which would be things like broccoli, cauliflower, cabbage, lettuce, tomatoes, onions, celery. Let's see what else is on that list. Green beans, any of the veggies really that are not counted as starchy. So starchy veggies would be things like corn, potatoes, peas, winter squash like butternut, acorn squash. So those ones wouldn't necessarily count, but usually they'll let you have 1 to 3 servings, which is any of the non-starchy veggies, which is anywhere from a cup to a cup and a half with that meal. And then they're also going to allow you to have a little bit of starch, and that would be certain starches. They usually give you a list. It's not just any starch or carbohydrate food. They give you very specific lists about what that would be. That potentially could be what they do for the actual food diet. Or they may just give you a meal plan and say, hey, for these 2 weeks or this month, you have to follow this exactly as we tell you. So every practice is a little bit different. Most give you a little bit of leeway to help you make choices, or maybe they give you a list of what you can, their meal plan, and then they give you ideas for things you could swap out. So that could potentially be what they would do for you as well. And then there's kind of one last group that maybe seems like more of the lucky group, and I have a surgeon, this is what he does with his patients. He actually has them drink warm lemon water in the morning, follow that with a protein shake, and then they read nutrition labels, and there are certain things that he tells them they can't have. So he may tell them no high fructose corn syrup, he may tell them no canola oil, no vegetable oil, no soybean oil. So they're reading labels of everything, and what actually happens with them is they actually end up eating a healthier diet, because as they start reading labels and getting familiar with that, really they're getting the foods they're eating closer to the natural way it's prepared. So it's not having a lot of sauces and marinades. The salad dressings or mayo that they're using has less ingredients in it. So you may be part of that. So those are the diets that I typically see in my practice, whether it's a meal replacement, the protein liquid diet, real food diet, or that lucky little group that they're really doing lemon water protein shakes and label reading. So you might be one of those 4 groups, or maybe your surgeon has come up with kind of his own thing and it's a hybrid of all of those. But typically what that diet is, that the purpose of the diet is shrink your liver, which sits across the top of your stomach. So all of these diets are going to be low calorie, low carb, low fat, and typically high protein. So no matter what diet you're following, make sure you're following the surgeon's instructions. They have specific reasons. They want you to do it the way that they have you doing it. Okay? Add a couple bonus things in there for you, just for you to begin to understand how you need to do this pre-op diet. It shouldn't be torture for you. It should be something that you look forward to as the beginning of your new adventure. So a couple things. One, I would tell you, start early in the day. So if you're somebody that maybe before surgery you didn't start eating until lunch or dinner time, if you do that with your liquid diet, you will be so hungry you can't stand yourself. Or you'll start to feel really sick, like when it's time for you to normally eat. Like what I've seen with most of my patients is if they eat once or twice a day, and it's usually later in the day, their meals are a little bit bigger. And what happens is when you eat that meal late in the day, it takes a long time to digest it. So you're not getting hungry until noon the next day. Once you start this liquid diet, or your pre-op diet, whatever it is, make sure that you start that early in the day, even if you don't feel like eating, because you're eating a lot less. So the other advice I have for you is check with your surgeon about medications. If you are taking medications specifically for diabetes, for maybe to control your blood pressure, like a water pill, because your eating and drinking is different now, or maybe you've gone from eating food to being on a liquid diet, or you're making adjustments along the way. If that is happening, then what you want to do is check with your surgeon, check with your primary care physician as well, because they maybe need to make adjustments with some of those medications. Because if you start to feel sick, you start to feel nauseated, if you're taking insulin and you go from eating food to a liquid protein diet, or you're going from eating regular food to eating meal replacements, or you're eating real food, but you're eating differently and you're eating a lot less, then your blood sugars may not be as high. You may not need as much insulin. You may not need as much medication, or, maybe your fluid drinking is different. So they may have to adjust your water pill for you as well. So those are things to keep in mind. Be your own advocate. Ask your doctor, ask your surgeon about that as you're going through the process to make sure everything is the way that it needs to be for you to set you up for success. Okay? And if you feel bad, if you start feeling really bad, contact your surgeon's office. Contact them and ask them, talk to their nurse to see what maybe you need to do. And like I said before, make sure you're staying hydrated, because sometimes people start to feel dizzy and nauseated and they're just not used to drinking, and so they're not drinking enough fluid. So really up your fluid intake, unless there's some reason that they tell you not to, like you're on a fluid restriction or something like that. But for anybody that's not in that category, we want to increase your fluid intake. The other thing is the first 4 days are the toughest. So what I've seen with most people, that's when their body's kind of readjusting. Maybe they're having more nausea. Maybe they're more fatigued and tired. Maybe they're having more brain fog. They're having headaches because they were drinking caffeine and soda before and they're not drinking that now. So all of those things can attribute to that. So make sure those first 4 days, once you start this liquid diet, give yourself a little bit of room. Make sure your schedule isn't jam-packed. If you're working, make sure that you're taking it easy at work to make sure that you're feeling okay. So, and I've seen that people lose anywhere from 5 to 30 pounds on their pre-op liquid diet alone. So, that's a great way to start out, where you're headed. So we already talked a little bit about the why. Why do you do this? We want to shrink your liver, which sits across the top of your stomach. So they want to make your liver smaller so they can get to the stomach easier. From the surgeons and the nurses that I work with, what they've told me is that when people don't do the liver shrinking diet properly and their liver is enlarged, they've got to use a tool called a retractor to push the liver up and out of the way. And what they've told me, I've not heard it from patients directly, but what they're telling me is they're having more people complain of pain when their liver is enlarged and they've got to move it out of the way. So do the best you can during the run up to surgery and those months before surgery to work on adjusting and changing your eating habits, because that all of that, as you're losing weight, your liver is shrinking as well, and it really shrinks in that time frame when they have you on this specific diet before surgery. So if somebody told me there's something I could do that would maybe decrease some of the pain that I was feeling at surgery, then I'm probably more than likely I'm going to do that thing, even if it causes me a little bit of pain and discomfort in the run up to that. So just keep that in mind. And also it helps to have better outcomes after surgery, helps to be less complications because the liver is smaller and there's not as much maneuvering around that your surgeon is going to have to do. So that's the why. So now let's talk about those bonus tips. I already kind of dove in and gave you kind of a couple extras, but let me give you a few more. So these are the things that I've seen in my practice. One, they usually are going to tell you to limit or eliminate caffeine. So if you are a coffee drinker and you're drinking 4, cups of coffee a day, or you're going through Starbucks or Dunkin' Donuts and you're getting a really big coffee, now is this time to begin to wean yourself off of that a little bit and start increasing your water intake as well. So if you're finding that you're using coffee to kind of pep you up, you might be kind of dehydrated, and it may be the coffee causing it as well. So that's something to think about. But the reason the surgeons typically will eliminate or eliminate or limit caffeine is because it can actually increase your heart rate and increase your blood pressure. And what I've seen is surgeons allowing anywhere from no to 16 ounces, which is about 2 8-ounce cups of coffee. And then typically energy drinks are a no-no. Second thing is no soda. So if you are a big soda drinker, hopefully as you've been working with your surgeon in the months before surgery and those pre-op appointments, you have already started to wean yourself off of soda. So regular soda definitely is a no-no, and they're going to tell you when you start this diet, no soda. So, and that also, if you're reducing caffeine, if you're reducing soda, especially caffeinated sodas, you might find that you have a little bit more of a headache. So I would start weaning yourself off that beforehand, and that may very well help you. Tip number 3 is usually no milk. So except for fat-free cow's milk or like an unsweetened almond milk, they might let you do an unsweetened soy milk, something that has really low calories. What I've seen is normally they'll limit that to about 3 cups of fat-free or unsweetened nut milks a day. Other milks have a higher fat content, and so that is something that they are trying to steer you away from. Remember, this diet is low calorie, low fat, low carb, high protein. So that's tip number 3. Usually it's no milk. Tip number 4 is no alcohol. So alcohol can affect the liver and can increase complications before and after surgery. Tip number 5 is to start a multivitamin. So it doesn't matter, your surgeon may have a specific one that they have you take, but in general, what we recommend is just a good multivitamin, a good 1-a-day vitamin. Whether it's one for men or for women or over 50 or whatever. You don't need to do anything fancy like a prenatal vitamin. Some people will start taking their bariatric vitamins at this point if their surgeon recommends that, but you don't need that. Just a good 1-a-day vitamin. Get enough, if you're not already taking a multivitamin, just get enough that's going to last you through however long you are on this specific diet. So that would be our tip number 5. Tip number 6 is something that I learned working with my surgeons, and they are telling me that it works really, really well for liver shrinking. They are having their patients do, like I told you before, that half a lemon, squeeze into a half a cup of water that's warmed up in the microwave, and then drink that. So there is some thinking that helps to shrink the liver, doing that and then drinking the protein shake right after that. So they're seeing when they go in, they're seeing good results with that. One surgeon so much that he does that and he has people doing label reading, and that's his pre-op diet altogether. So that tells me he's seeing pretty good results with that. So those are our bonus tips, but let's talk about that freebie I promised you. So in our description below, you will find our top 5 strategies for success after weight loss surgery to get you started on the right foot. So go ahead and get down there, grab that link, get your freebie from us. And if this video has been helpful to you, please subscribe and like it so that we can help more people figure out this weight loss surgery thing and how to do it right. All right, well, you take care, and I'll see you soon. All right, bye.